On Thursdays, we take a look into the latest health and medical news.
Megan Ganish joins us now with an update from an Ebola survivor.
Yes, thanks, ladies. It's quite a story. Nigerian Dennis Akaga, a fiance to one of the nurses who lost her life to the Ebola virus, shared his story of how he survived this deadly disease. Akaga only spent a few days in the Lagos Treatment Center before being discharged, put under surveillance, and later declared Ebola-free. But Akaga lost his fiance, their marriage plans, their unborn child, and his job in just a few weeks. His fiance, a 30-year-old nurse who was also pregnant, died in the middle of August after she helped treat an infected Liberian-American man who brought the virus from Monrovia. Akaga believes he is a miracle.
A miracle, a testimony of someone who got healed from Ebola. You know, people were there before me. I don't know if you understand. People were there before me. People stayed there for like 3 weeks. People stayed there for like 1 month. But I went in there and I came out just 5 days. So it's a miracle.
Akaga wants to let other people know Ebola is not a death sentence. The U.S. donated 5 ambulances to the Sierra Leone government yesterday as a part of the effort to help contain the Ebola outbreak. A surge in Ebola is placing health workers at risk as they struggle to treat patients. The head of the U.S. mission, Kathleen Fitzgibbon, handed the keys for the ambulances directly to Sierra Leone's president, Ernest Bai Koroma.
The government made the request, and our government decided this is an emergency. It's not a peace or conflict situation, but it is something very important to donate to. So that's why we found that we had these ambulances that we could take from another mission and bring and donate here. So, and then we got the request, and we were happy to be able to answer.
The World Health Organization gave no details, but an American who was infected while working in West Africa landed in the U.S. Tuesday to get treatment at Emory University Hospital. This is the second WHO staffer to be infected in Sierra Leone. Military families know that a welcome home is often easier said than done, especially if there's been an injury. But a new $11 million Intrepid Spirit Center aims to treat military members with traumatic brain injury and psychological conditions. Cody Ingdahl has more.
Insurgent drove a truck with 10 tons of TNT and ammonium nitrate into the outer wall.
Several RPGs hit our truck when we were doing a convoy. I just basically fell out of the truck.
These are some of the things that happen to our troops when they fight for our country. And for many, like Specialist Hernandez, it happened more than once.
Hit an IED, really huge IED, and I recall a little bit of it, and I just remember taking some small arm fires.
Specialist Hernandez has deployed twice. Both times he suffered a head injury. This is where he recovered. The grand opening of the Intrepid Spirit Center, specializing in head injuries and post-traumatic stress disorder. But why here?
The battlefield comes back here, and that's why we're building the Intrepid Spirits out where the post camps and stations are, because that's where the troops are.
The center has been open for months, actually, and has already treated soldiers like Hernandez. It includes a whole range of treatment for head injuries and PSD. The center even employs optometrists who have helped men like Sergeant Major Hammerly with his vision.
These can pull my eyes together so I can read.
It's the third of 9 of these centers the Intrepid Fallen Hero Fund plans to build, and not $1 of taxpayer money. It's funded completely by donations.
Some 650,000 Americans, some give a check for $10, some write a bigger check. The American people understand the debt they owe America's sons and daughters who have worn the uniform and borne the burden of battle.
This is the third of 9 centers planned by the Intrepid Fallen Heroes Fund. If you want to learn more about the group's mission, visit fallenheroesfund.org. And the great thing about these centers is that they're already located where military bases are located in the U.S.
So I imagine that makes a lot of returning soldiers. It makes it easier for them to receive treatment and just go to these facilities, since a lot of them do already live near the military bases.
Yes, exactly. That's the purpose.
These heroes do so much for us. It's kind of nice to be able to give back to them. Thanks, Megan.